Israel's biggest hospital is ready to reshape international medicine. Sheba Medical Center, just outside Tel Aviv, signed a major deal with Chicago's Mayo Clinic to share high-tech medical solutions between the two countries.
Chicago is actually the third largest market in the U.S. for healthcare. And what Chicago Arc has done is put partnerships in place with the leading health systems there so that when we meet startups here with Sheba in Arc, we are able to talk to them about the needs in the United States, invest in those companies, and then bring them into Chicago.
The partnership is being run through Sheba's Arc Center, the development hub for new medical technologies. And this week, the hospital opened its doors to the public to show how it plans to change the rules of the game. A big one. A new augmented reality complex for both treatment and training.
Rehab is a field with a lot of applications that virtual reality and augmented reality can help. For example, over there, we have occupational therapists challenging patients after a stroke with motor dysfunctions or any of that, running around and with all kinds of games where they need to kind of stretch their hands beyond their range of motion.
We wanted the simulation to be as real as possible.
Doctors from all over got to experience Sheba's blended virtual and physical simulations. And that blood looks realistic.
The concept is like in aviation. The concept is let us train on the alternative to the real patient before we actually do the real patients.
New tools for surgery, artificial intelligence, even just data tools. They are transforming the medical world into a 21st century industry. It's something doctors had to learn fast during the pandemic.
Of course, that ICU experience is something that is limited to the actual personnel. But we could gap that by actually working with these kind of tools, giving expert opinion and experience from experienced personnel to young nurses and doctors that didn't actually know what they were doing.
Now, after proving themselves in the crucible of trial and error for 2 years, these technologies are mature and ready to be the new industry standard. And combined with the enormous reach and resources the Mayo Clinic has to offer, these next-generation technologies could soon become the norm.